Great. So we're planning for this to be sparkling and dynamic. So we've managed to pull together some of the, well, that's a comparison, which is terrible, Jamie. Some of, in my opinion, the most interesting people to talk about this topic of AI, not from an esoteric perspective, but from a very grounded perspective. So to do a couple of intros, we're lucky to have Lori Block. So Lori's a clinician by background, and you've got their bios in the package, so I won't belabor the bios, but I will just say that Lori is an extraordinarily special person to have on a panel like this. She's cringing, I'm sorry, Lori, because she's a clinician by background and a wound care nurse. And her practice, when we're talking about AI and we're thinking about equity issues, that background and grounded practice for equity-deserving groups, I think is quite critical to this discussion. She's also just a phenomenal advocate for the engaged role of clinicians in the AI transformation journey. So I think we'll see some of those perspectives coming out as we talk today. Next to her is Carol. Carol is a managing partner at I&Q Law and I&Q Consulting, phenomenal group. And Carol is spectacular because she's a lawyer by background, but don't cringe, she's the magic kind. And she's also quite interesting in this discussion because she's got a very strong grounding in healthcare, but has an ear and a voice at AI leadership and regulatory tables within Canada and internationally. And perhaps, Jamie, I should let you introduce, I keep calling him Dr. Alex, which is as awkward as you can get.
I forgot my microphone, so maybe I could introduce. But if everyone can hear me, so, Dr. Alex started off as a former elite athlete, participated in Canada and games, decided that medicine was what he wanted to pursue. Not that long after, and for the last 15 years, actually, the technology component of medicine. So very much involved in the early stage technology, whether it be AI or data and otherwise. And is the CEO of Healwell AI, a publicly traded company here in Canada that's focused on revolutionizing healthcare in Canada with artificial intelligence.
All right, so let's get you mic'd up while we take care of this. So we're going to have a pretty informal conversation. So there's going to be lots of opportunities to invite you folks to come on up to a mic and join us in this conversation. Because when we were doing our prep calls, one of the things that I found most interesting was how very lively this conversation is. So I'm going to ask Lori, if you don't mind, do you mind kicking us off? So we've structured this, as you've seen in the description, as being a bit of, okay, where are we today? Where do we want to get to? And what are some of the challenges and opportunities we're going to hit? So can you start us off, Lori, talking about, from a clinical practice perspective, as well as working on your PhD, where are you seeing AI being useful, and how do you think we can build from there?
Hi, everyone. Y'all hear me? So I work here in Vancouver, and I work with clinical informatics. So I have a great opportunity to be a clinician, work with clinicians, interact with patients. And where we're seeing it, I would say in my small corner of the world, we're seeing it in pockets, and they're amazing pockets. We're seeing it in imaging. So I think probably there's some folks here working in that area, looking at how we can understand images more effectively with AI support. We are seeing examples. I hear Fraser Health has some great embedded machine learning inputs where they're helping predict UTI, or urinary tract infection, and delirium in patients. We're starting to see pockets of within the health authority working with universities. So I am so lucky to be working with the University of British Columbia, Dr. Charlene Ronquillo from the School of Nursing, Dr. Zhao Zhao Li from engineering, and we're giving data and we're learning from each other to unpack how social determinants of health is a predictor for wound care outcomes. And so we're sending hundreds of thousands of data points for machine learning and natural language processing in that space. And yeah, lots of opportunities. I hear from industry as well, which I'm excited to see where that lands. But also the reality check. I work with home care nurses. We are still writing, beside point of care, those notes, and 6 hours later, translating them into the electronic health record. We have smartphones that are issued by our health authority partners where we're texting and doing FaceTime with our colleagues, but there's still a lot of space which we need to consider.
Dr. Dombrowski, do you want to bring in the industry perspective into this?
Sure. Thank you very much for having me, by the way. Jamie, thanks for the introduction. And Lori, I don't know how you balance things also while doing a PhD. So good luck. That's incredible. And Carol, I have to give Carol some credit here because she works right at the pointy end of regulation. And I think from an industry perspective, it's easy to put your hat on and say, you know what, as an entrepreneur, regulation isn't moving fast enough, or Canada is lagging behind other jurisdictions. But I think actually Canada has a very unique mix of qualities. I think there's been a cadence set at a federal level that trickled down about a decade and a half ago, which I don't know if it was necessarily the pandemic that sparked this psyche change amongst providers and clinicians to adopt technology at a faster pace, or if it was actually the government in the early 2000s with some of their changes that actually allowed for that that pace of innovation to change. So anyways, what I'm trying to get to is that I think there's an environment in Canada that's very ripe for creating pockets of innovators that are working with experts like Carol, kind of in that pre-regulation space. And I've had some experience there myself, and that's not easy to do, right? You're trying to trailblaze, and especially you're trying to do it in healthcare. But now we're seeing, specifically over the last 3 to 4 years, and Carol, you know the landscape very well, but we're seeing these technologies, what were nascent technologies. My background is in diagnostic imaging, which was one of the first areas of healthcare really to start applying, labeling, comprehensive data sets and applying computer-assisted diagnostics to those data sets. But now we're seeing, nascent technologies across, or what were nascent technologies across all specialties, starting to mature to the point where there's evidence now that's being published that's supporting and validating these technologies. And they're getting to the point where, clinicians, not just kind of the quirky ones that want to test these types of technologies, but there's a bit more of I'd say a wave now of clinicians that are willing to or wanting to actually deploy these technologies. And I'll go back to radiology in just a second. The company I run right now is focused on preventative care, but it wasn't too long ago where there was keynotes at RSNA, one of the big radiology conferences, talking and showing how some of these technologies are not just a magnitude better or safer at detecting whether it was a very narrow scope of diagnostics or issues, but 2 magnitudes, so 100 times more effective than the human trained radiologist. So I can see that happening in all sorts of different specialty areas, and I think it's a very, very exciting time to be working in this space. So that's just a couple kind of all over the place industry comments, but
It's a nice
thanks.
survey, though. So pre-regulation space, that is an excellent kind of transition into Carol. Is that an apt way of describing where we are from a regulatory context?
Yeah, when it comes to the regulation of the technology itself. So where we are right now, and I absolutely agree that the pandemic really catalyzed a lot of the conversation around technology in healthcare. So if you look at some of the statistics for virtual care prior to COVID, they were, I think it was like a 15% adoption rate. And then by March 2020, it was an 86% adoption rate or something like that. And so we saw this acceleration in adoption of technology, which is a good thing in the health space. There are lots of reasons we want to be leveraging more sophisticated technology. But I don't need to tell you that we want to leverage this technology in a way that will do no harm, that is responsible. The problem is where we have this dichotomy type debate, which is either you innovate or you prevent risk. And I don't think it can be that way. We have to get a little bit more comfortable with that gray zone where we accept the fact that we are going to be leveraging more sophisticated technology, and that in so doing, we have to define the risk as we go. So to speak, I'm going to sort of build the plane as I fly it. And that's sort of where I live, and that's where I've lived for a number of years, which is a little bit funny because I am a litigator by training. I used to do a lot of medical negligence litigation and doctor defense work. And then all of a sudden I found myself in a position where I was trying to understand, well, what are the implications of this very sophisticated technology and how would I argue it? Like how would I look at this in different ways? So the context today, we have law that is on the books. We have guardrails, we have best practices, we have policies that already tell us what is a good idea or a bad idea, what are good practices, and what are riskier practices. Where we are entering, and we are in the pre-regulation phase, is when it comes to this notion of artificial intelligence. You have a computer system that is processing massive amounts of data and producing an output, a prediction, an action that we can't really understand, and that is highly persuasive, or it has a huge impact. And it's in this space where we live right now, where the technology is catching up very, very, very quickly. And the law is sort of sitting back and saying, okay, well, where are the harms? And what are we going to do to put in place guardrails to mitigate those harms? That's where we sit today.
And that's a nice positioning. So because you're starting to talk about trust in the technology, there is certainly, I think, a growing sense of urgency around this regulation question. And I expect it's about the concern about losing trust and needing to build trust in a positive dimension with the public. Like I think about some of the data that our performance evaluation and benefits and analysis team has pulled, including around AI. And it's one of the areas where we see, and Simon's going to cringe because I'm not going to use technically appropriate language here, but far more mixed opinions and perceptions. And when we ask Canadians about their desire for digital health, their support for the use of information to support their care, it's a no-brainer. It's full support, it's strong support, it's emphatic support. When we start adding some of the technical dimensions, there's some uncertainty that comes out in the data. So is that what you'd attribute some of this forceful push? Like we saw the executive order in the States yesterday, last week. Is that, so two parts of the question. One is, do you feel a sense of urgency in the regulatory space? And perhaps as well as a group, we might talk a little bit about the impacts of that ambiguity, that legislative ambiguity.
I'm happy to take a run at the two-parter. So let me give you an example. I'll tell you a little story. Back in 2018, when I started down this wild and wacky world of AI and law, which in 2018, it was wild and wacky, it still is, I saw Dr. Jeff Hinton speak, and he is considered one of the grandfathers of the most advanced AI as we see it today. So really shepherding some of the most interesting artificial intelligence. And at the time, I was sitting in a room that was a fraction of the size of this. And it was at U of T, and I was listening to him speak, and he said, he was asked a question about artificial general intelligence. So this ability for a computer system to achieve such level of intelligence that it could mimic and confuse human behavior, okay? And he said, not in my lifetime. Not in my lifetime. And I distinctly remember that because I was like, okay, great, I've got nothing to worry about. I also might not have a career going forward, so that's too bad. I should rethink this. 3 months ago, or maybe even less, he left his job at Google. And when he was asked why did he leave his job at Google, he said he wanted to speak more freely about some of the risks to do with artificial intelligence. Not the kind of artificial intelligence we're talking about here. We're talking about what the sort of front lines of research and development look like. And when he was asked why he left, he said, I was worried about I want to speak more freely about this because I thought it was not in my lifetime, and clearly I'm wrong. And so when we talk about the ambiguity and we talk about the space that we're in and the urgency, we are very much, again, in this gray zone. We are in a place where lots of conversations are happening, and it's very, very difficult sometimes to see the forest from the trees. So that story that I told you is an indication of why you feel a regulatory urgency, but it should not be a story for why you don't adopt technology. That should not be the barrier. Instead, we should look for opportunities to identify pain points in our system and find solutions that sort of ease those pain points and make it a better experience for patients.
Is that, so in your experience, is that the scary AI an inhibition, the fear of liability, the fear of proceeding in the absence of clear and very specific regulation? Is it impeding adoption from where you're sitting, do you think, Dr. Ruskin?
I think that's a good question. I may dovetail just for a moment as I answer that, and I think Don is here in the crowd. So Don Watts is a colleague of mine. He runs a subsidiary, a company that the company I run owns, which has developed technology over a number of years, which has demonstrated key competency in being able to screen EMR records and risk stratify patients for different conditions. And the approach that Don, and under his leadership that he's taken in terms of developing this technology, introducing it, there isn't in fact an angle where the technology is threatening from a liability perspective or to the physician that, like, is this a piece of technology that's going to replace me? It's simply, I guess, under the bracket of clinical decision support or as we head in that direction. Right, so it's one prong of a many kind of layered approach. So I don't think I've seen yet in healthcare technology that you would be so adverse to saying, look, if I use this, there's huge liability issues. I don't know what this is doing. Like, it's a black box and we don't understand the principles behind it. Like in radiology, for instance, the first kind of technologies were focused around that were harnessing machine learning and then kind of graduated into artificial intelligence, were simply correcting artifacts in the images that were produced, and in particular in MRI scans, et cetera. So not actually even on the diagnostic spectrum yet.
Carol, your team, we worked with you on an AI toolkit that's on Infoway's website that we've recently refreshed and republished because the space is moving. And one of the things I like about it is that it does exactly what you're all describing. Triaging, if you will, creating some definition in the vast array that is AI between an administrative intervention, for example, a low-risk intervention, and some of the more significant risks. So if liability isn't the barrier, that perception of there's not a magical rule. Lori, do you mind talking to us about what you're seeing from a clinical perspective as being some of the frictions to the implementation of AI or the potential problems you're seeing?
Yeah. I also have a bit of a thought piece, or I'll say something that's maybe provocative and complicated in my profession of nursing. We cannot become the handmaidens of AI. And I say that in how some of the work is starting that I see translate, where we have amazing machine learning that's predicting things like prediction of pressure injuries, prediction of sepsis, prediction of UTI, protection of falls, increased length of stay. And so if we're building out what the implementation or the interventions associate with that are things like the nurse, informed physician, informed physician, informed physician, informed physician. Not that I don't want to inform and include in that conversation with my colleagues, that interdisciplinary team, but it's that fine shift of asking how are we using these technologies to support our care and ensuring that we're not losing our clinical knowledge, our ability to understand context, which is often missing at this point in AI, to be able, and what I appreciate in that toolkit is this right for refusal. And so this idea of liability, I think, is really important for clinicians to have conversations about, but also to understand the nuance of the profession you're asking, because those conversations might have a blanket understanding for the profession, but it might have nuances of what it means for nursing in our scope of practice and medicine, respiratory therapy, occupational therapy, care aids. And so, it's a big spectrum of what liability is, how we're using it, and ensuring that it's supporting our practice. It really is that practical conversation of what is decision support and how is it going to be used in practice.
It's striking to me as you're speaking that it's not a brand new world of due diligence or consideration or implementation. It's coming back to what we started the day with. You don't just plunk a piece of technology into a care setting and expect magic to happen. you think about change management, you think about how we evolve our existing legislative and regulatory frameworks, but it's an extension, it's not a net new world per se. So it's an interesting commonality.
I think Lori's also highlighting how there's a lot of work, right, that needs to be done on, okay, how are these technologies actually introduced into a workflow without, let's say, damaging that workflow.
Yeah.
Right, so that's interesting to hear, and just how many kind of unique technologies that you're witnessing being used, right, to assess a patient, from wound care management, et cetera.
I'm going to take a pause because I've been talking too much. This is the start of the invitation to join our conversation. So I'm going to allow us to pause for a moment to see if anyone wants to step up to the mic. Otherwise, we'll continue right ahead.
I'm just going to add a quick question while we get some folks up at the microphone, and I'll position this to you, Dr. Alex. So if you think about, we talked a lot about the regulation and the concern, but I think we also want to talk about the opportunity, right? And it seems like the possibilities are endless. And if you look at major health systems today and major vendors out there, they all are building AI into their core product. And Meditech, for example, I saw very recently, they have a whole new AI offering. And so when you think about, I'll speak a little louder. Yeah. Are you thinking about it from a perspective of physician efficiency and healthcare team efficiency, or is it patient outcomes? Is it all the above? Is it one before the other? Can you speak a little bit to that?
Yeah, no, sure. I'd love to. I think I'll make a separate comment, because this I think many people in the audience will appreciate, and of course you guys both will as well. I'm noticing that across different industry sectors, whether it's life science, pharma, medical device, and also within health systems, hospital groups, everyone's standing up these teams of innovation, right? Chief innovation officers, they're pouring money into teams, and there's a lot of groups that are doing the same work, siloed in their own domains. And I think some of the work that's done by Canada Health Infoway, right, is helping kind of break those silos. But in terms of AI, like at that pointy end of innovation, there's still tremendous silos everywhere. And I know my team and two of my team members are here. They can attest to that, right? They work with across different sectors and across academic institutions, right? So there's a lot of siloing. But on that point, there's also an incredible amount of investment and inertia. And now to answer your question, Jamie, so the way we look at it is what kind of technology, right, can have the most dramatic impact for, number one, patient outcomes, number two, physician workload and burden, and number three, cost savings for a healthcare system. And where we've landed, and I'm happy to take other perspectives though, is in technology that helps you to detect or identify disease earlier. That's where we think is kind of the crosshairs of that almost perfect storm. Late diagnosis leads to just a huge cumbersome amount of cost to the health system, right? I think we all know kind of the sequelae of late diagnosis. So that's where we have focused our attention. And then, so not just early detection, but in the community setting, right? So we're not trying to tackle things from a kind of hyper specialist perspective. It's, can we deploy technology? And as example, one of our partner networks is Well Health, which is a very big footprint. So can we deploy technology and scale it through, for example, a big community footprint presence where we think our technology can measurably, right, improve a lot of patient lives.
Lori, how does that align with your experience in the clinical world?
We can do for prevention in that space. I was also reflecting a little bit on, you talked about kind of that mix of the opportunities, and I think you spoke to that well. Data as a byproduct of care is what I'm super interested in. Again, I go back, just imagine you are a home care nurse taking care of someone with a venous ulcer. And we know that that's not episodic, that's long-term. We're going to have a lot of need to interact with many specialists, with different professions coming in and supporting that client in that care. And like I said before, right now, a lot of nursing care in that space is done, on paper, and we're translating it. Data or documentation is a byproduct of care. What I'm interested in, and I know there's privacy and bias and considerations that go into what I'm going to say, but being able to converse with a patient without that piece of technology in my face is still something I want. So can we have those kind of tools that will listen and maybe automate some of that documentation for me? When I do wound care dressing, my hands are gloved. Can I have some device or wearable where I can say, take photo, and that it can, have some synthesis of the analysis of, well, what's happening with that photo and compare it to previous photos, and maybe do some automated measurements. And I know these technologies are available and emerging. And then provide insights that are attuned to me in my profession that's appropriate. So maybe my client's at risk for sepsis, or even cellulitis, and that the intervention care plan requires an oral antibiotic, but that's outside of my scope. So what does that mean for me? Well, I can apply topical antimicrobials as a nurse. That's within my scope. And so ensuring that we're delivering these technologies appropriate to the profession, the setting, and the space. I welcome innovators and industry to help us in this area and partner. We want to partner. We want to be able to say that, our professions, nursing, medicine, pharmacy that I heard earlier, are wanting to partner in this work. We are your new interdisciplinary team, where we're having engineers and scientists and clinicians and legal and privacy all working together to make these things happen. And of course, that patient voice, absolutely central.
That was the most striking thing. When we first talked, Lori, you talked with a language that I hadn't heard a lot before, which was about doing exactly that, engaging clinicians in a transformation in their practice to drive to things that are creating fiction for them, rather than having that being transformed, driving a transformation rather than being on the receiving end of it, which I thought was quite interesting.
Career in informatics is seeing workarounds. And when I first went into informatics, workarounds were seen as a negative word, or, the system wasn't built well. Well, yes, it's a symptom of it. However, we can look to clinicians of what those workarounds are to be those points of innovation. We've figured out a way to do the work despite the technology maybe not meeting our needs. So really thinking about some of those opportunities as well. What are those workarounds that clinicians deal with? And use that as a conversation starter for the technology.
I'll position this one maybe to you, Carol, but it's for the panel. So Canada has been known as a AI innovation hub around the world, right? We've got some of the global leaders you mentioned, Jeffrey Hinton, and now we're thinking about AI in healthcare. Can Canada win? Can we be number one? Can we be nimble enough and figure out how to take advantage from your experience in the trenches as we kind of shape our frameworks? And then maybe I'll pass it around.
So I'm a natural optimist. I will always say, yes, we can win. I will say our adoption rates are very low compared to other jurisdictions, and our processes are fairly cumbersome. Yeah. So there's no reason we can't win. But the notion of the change management, I always think of it as the culture, right? It's the culture, it's the people. Yeah, how are you going to change? It's not about the technology. The technology we can figure out. We can ultimately find a way to leverage the data. So it really is about the people. And can you change hearts and minds to actually have the courage to try something new or to consult? If you look at AI law as it's bubbling up around the world, stakeholder engagement for high-risk AI systems is table stakes. They're all saying you got to have that in place, but nobody knows how to do it. Well, sounds pretty easy. I'm not trying to make something, make light of something, but it's that drive to decide that that's what we want to do. I think that's really critical for us. I think we have a question there.
I just have a question. I also work in nursing education, and so we are grappling right now with how to manage AI and how we teach AI in clinical practice, in their writing skills, all of those things, because the propensity to rely on it too much is, kind of impeding their clinical skills. And so we have, are trying to find ways in which to kind of mitigate that in the clinical teaching setting. This is just, these budding nurses and what is ahead of them. But, we don't want to, walk around with our heads in the sand either, to understand the power of AI. And so what would, you're a nurse, so what would you say? Because it's like a hot potato, and we are just, well, we could do this or do we not? Because, if we rely on it too much, because there's certain things you got to go through the trenches, you got to go through those hard yards. And if they rely on some of that too much, then it's gonna show up in the clinical space. So any answers, anything?
I know there's a lot of other brilliant educators in this room, so I'll just add one idea or thought to that. Thank you for your question. I feel it too. I know there are organizations like CASN and the Canadian Nursing Informatics Association struggling with this, but at an organizational and national level. So I think those are some resources to look into. But I'll always say, like, there's that didactic of like needing to know what is AI. Things like transparency, like clinicians are wanting to ask, how are they making these decisions that my patient's at risk for a UTI, this patient isn't? So this idea of transparency, and from the clinician lens, not from the engineering lens, of how does that data point come together? I think clinicians need to be educated and aware of that. We'll go back to our principles of nursing, of justice, ethics, equity. We still apply those aspects to our care and how we interpret. So still looking at those foundations of our practice set are still going to be usable and applicable to AI. So I think it's that spectrum of education and allowing our new and emerging clinicians to embrace that.
I'd love to add to that, because we see this in law as well, where there's a very rich discussion about, is AI going to disrupt profoundly our profession? I think the answer is yes, ultimately. And I have spent quite a bit of time with some of our country's judges talking about the implications of what that means. And I think it's really important that, number one, we bust two myths about AI right from the beginning, aside from the definitional one that is complicated enough. But there is this myth of perfection, that a system, because it's a computer system, it is somehow perfect. It is not. And then there is a myth of neutrality, that because it is not a human being, it is not biased, and thus it's neutral. It is not. And once we get at some of these myths and we bust these myths, we can start to apply more critical thinking. So I actually don't think our future is lazier. I think it's going to require even greater critical thinking in a sort of keener sense of how to assess information and understand where that information comes from and what are the implications of that information. But I will caution one thing. There is no should we, shouldn't we, are we going to go AI, are we not? It's not a thing. We are going to be using this technology. It's like saying, are we going to use the internet? Yes, you are. Absolutely. So now the question is how? So I'm a very big proponent of get past the sort of early 2000s question about, are we going to do this? And now let's get to the mature debate about what are we going to do to use it effectively.
Yeah, and how in each of our professions we extend upon our current methodology. Like, Lori, you did a great job of talking about the application of fundamental principles and tenets in the nursing profession. I was with a great group of healthcare security officers a couple weeks ago, and we spent a fair bit of time on this topic, both talking about AI as a threat to cybersecurity, but also talking about, for those folks who are working in a provincial health services authority in a large hospital, how do they adapt their existing due diligence processes to ask a few more questions, continue asking and maintaining those questions. What I was struck by was we do seem to be over the shock and awe and into the more practical, all right, I objectively just need a new checklist that will augment this. I'm going to need to no longer have a siloed interaction with the lawyers or with the privacy folks. We're actually going to have to engage together, which likely should have been a process from the start. So it does seem that we're at a point where we can augment our processes, rely on our existing professional diligence, just lean into it a bit closer here. Is that fair? possibly too optimistic. Shall we go to a question?
Privilege of belonging to a health innovation group that's sponsored by the Canada Space Agency, and it's called the Health Beyond Initiative. And one of our mandates is to help Canada become a world leader in developing AI technologies for the healthcare sector. And I recently participated in a think tank, and they asked me to take this and socialize it at conventions, conferences, and things in the health thing. We met with a number of biomedical developers, different entrepreneurs across Canada that are in this space, that are wanting to develop better AI technologies, better point of care diagnostics, better wearables, all of these things. And the common thread that came out of them is we have ideas, but we have nobody to evaluate. Mm-hmm. We have great technologies, but we don't know if the workflow would work. And so we put our heads together and we thought, well, we don't want to tie up a bunch of doctors' times or go knocking on their doors when they're strapped trying to see patients. And so what they asked me to bring forward and maybe socialize and have people think about and take back to their respective communities. Is there a way when we're at a conference like this or, a specific medical conference for neurology or cardiology where we could start having Dragon's Den fast and furious sessions where an entrepreneur could bring forward an idea, have a panel of doctors evaluate it and say, yes, that would work, or here's what you need to think about, and then take it back and let them continue on. Or maybe starting to set up boards where people could apply to have an idea evaluated medically and a little more precisely as to whether or not it's worth even investing in, worth putting in that effort in, or to evaluate the maturity of it before it actually goes to those next level of testing. So that was really what kind of the whole group put their minds together and thought this might be what takes Canada to the next level. We as a bigger, broader group came together and found the venues to push forward.
Mm-hmm. I would also encourage you to speak with Jeremy Petch of Hamilton Health Sciences, because he's doing very much that. So there are some forms like that. It's really fascinating because I'm involved in the Creative Destruction Lab out of U of T, and I've only done it once. And I was invited because of my background in AI regulation, and I sat down and I had these startups pitched to me, and I was sitting with a number of investors who are longtime entrepreneurs. And here I was asking, I was like, so what is your risk management plan? And the investors were looking and they were like, who cares? They have $2 to their name and they're just getting launched. What is their scalability? And the point is the perspectives were amazing because I just don't think the way they do and they don't think the way I do. So I love your idea, and I think it would be amazing to get together, but let's get all of if we're talking about excellence in Canadian innovation in the future, let's get all of these different perspectives together because I think that's really what rounds it out.
I don't know if this works. Let's see. Hi, my name is Jenna, and I am from Halifax, Nova Scotia, and I'm a patient partner. So a big thing with AI is that my university banned the use of AI. So if students aren't learning how to use AI in a lot of institutions, we can't really expect them to use it in their career if they're not learning how to use it in school. So my university was afraid of it. So they said, we're gonna ban it and students aren't allowed to use it. Therefore, we're not learning how to use it properly or appropriately. So what are you guys kind of doing to get over those barriers? Because I go to a pretty big university, and a lot of the other universities by where I live, which there's a lot of them in Nova Scotia, are planning to do the same thing. So what are you doing to bridge that barrier so that students can still be informed and know how to use AI even if their institution is not behind it?
Mm-hmm.
It's an interesting problem. So the view is, is this specifically tools like ChatGPT, that students were taking it
of any artificial intelligence at all. They mainly wanted us to not use ChatGPT for obvious reasons of avoiding plagiarism, which is so important in academic stuff. But any AI at all, we all had to sign a contract at the start of the school year that said if we used AI, we would be kicked out of school.
So, but that seems so wholeheartedly impractical. I think
That's the best way to frame it.
I think students will be using these technologies anyways, so it might not even have that big an impact. But I haven't heard of that, but
I teach at U of T in the Faculty of Law, and I teach on AI regs, so it would be very funny for me to show up in class and say, nobody's allowed using AI, like that would be weird. So instead what I did is I just said, we're gonna do papers or whatever, but really we're gonna focus on presentation. I wanna hear your thinking. I want to understand how you think. And frankly, whatever you write in our 6-week course in AI regs is not going to be groundbreaking, like by all likely. But I want to hear how you think. I want to know if you can be a critical thinker in this respect. And to me, that was my workaround, just to draw. That's how I want to get out of it. I also will tell you, I have one client in particular who is in the tech space and came to me and said, our parent company has said we have to ban AI. Can you draft an AI policy that bans AI? And I'm thinking, well, that will take about 30 seconds. But what I said to them was, no, I'm not doing that. Here's what I'm going to do. I'm going to give you a policy that bans AI at first instance, but that opens the door for good ideas to come to an AI committee that can then consider the idea and take the considered idea up back to the parent company, who surely will never want to pass on it. But we're not going to close the door on it now.
And I think that's the more maturing, evolving approach. So we've been asking these questions with other large health organizations, particularly the mature ones, to say, yes, AI can be a threat. Like, we are appropriately concerned about protecting IP, appropriately concerned with protecting personal information and personal health information. So how do we create the context in which we can leverage these tools appropriately? We're seeing large enterprises exploring how do you use the tool, so the ability to learn and pollinate your data, if you will, using a bit of a walled garden approach. So creating your own little mini chat GPT instance. So that's something I think we'll start to see become more and more accessible. Right now, that's a very expensive approach, but I think will be increasingly accessible. And that's intended to moderate the real risk. So what are we worried about? You're worried about plagiarism. You're worried about compromising your IP. You're worrying about having a world of not curated data, dumb data, influencing the smart outcomes you want to achieve. So I think we're starting to get a little bit smarter about what are the actual risks. It's not AI writ large. It's specific aspects and risks that can come with AI. So then how do we insert the appropriate controls and methods to create a safe environment? Because to your point, it is, I'd love to just say, wearing solely my security hat, let's all hide under the desk, pretend it's not out there, and the world will be a happy place. But that's not the world we're evolving into. So how do we allow the safe space for that exploration with the right data and the right data sets and the right utilization, so the right use cases, as it were, as opposed to writ large letting the world unfold? That, I think, is going to be a bit of the magic here. How do we continue a thoughtful pace forward, not be crippled by risk, while at the same time being cognizant to not create additional friction, so not create poor workflows that diminish the quality of our clinicians' experiences as opposed to enhancing them. So this is, I think we're at a good moment.
I want to just pick up on that last point, because my favorite sentence is like, what are you worried about, or what should we worry about? I ask that many times in a day. What should I worry about today? And in your university's case, what they should be worrying about is not a tool. They are worried about you learning, you becoming a critical thinker, you going out in the world and being able to have a positive change. The tool is not the thing that is necessarily going to tip you one way or the other. And so you can always go back to the university and say, you want us to be critical thinkers, but you also have to be a critical thinker about this technology and deconstruct why you say we can't use it.
A wild time since it's so new, but like my perspective is, when the internet was like brand new from when I was born, my mom was like, everyone was so afraid of it, but now everyone uses the internet like it's normal. And I definitely think that might happen with this, that AI is so new, everyone's terrified, but with time, I think people will get adjusted.
So if we continue this panel, I'm going to feel archaic because you just used some phrases that made me feel like the oldest woman on earth. And I was feeling reasonably progressive leading into that. So I'm going to just have a moment to emotionally recover from that. And thank you very much. I hope you've enjoyed this conversation as much. Oh, we have time for one more. Well, no one's dragged me off. So one more.
So Alex at Equinox. My son in college, their knee-jerk reaction was to even ban cell phones and laptops. So it goes even further what they're saying in university. And then speaking with Dr. Bo Wang, first chief artificial intelligence scientist at University Health Network, he says they force their students to use AI so that they can learn about hallucination and how to generate prompts and how to understand that technology. So in that regard, as we're going to the nexus of how do we implement that, and you were talking, Lorraine, about how nurses are still taking time handwriting things and then transcribing them into the EMR, we have this huge chasm of how to apply this in the workflow in a practical, in an impactful way. Have you found, or have you worked on, or where would be the forum to work on an evaluation framework that would help systematize this work? Because I think a lot of policymakers don't understand the difference between Bayesian and generative AI, or what are the considerations for what tool is actually fit for purpose and how to bring it to workflow. So just curious as to where you've seen that come to fruition.
I'm so glad we ended on that question, though, because I think it points to, thank you so much for asking it, because it points to our opportunity for collective action. So you referenced Dr. Pish over at Hamilton. That's a great example of a program that's emerging that we can all learn from and apply those evaluation methodologies. We've talked about opportunities to test and trial and utilize broad expertise. I think it's now at a moment where we identify and how do we pick some of those instances and move forward in a concrete and thoughtful way, whether that be another toolkit or a utilization document. So perhaps it's a clinical utilization piece. We've seen other jurisdictions also embracing leveraging on a national scale opportunities to conform and understand algorithms and understand the application of them as opposed to moving institution by institution. So that was a wonderful, and then I'll hand it over to the panelists to close off, but a wonderful way of reminding us that our purpose here today together in this room is to identify those opportunities to act as a community to make better connections for our patients. So I thank you for adding it. And should we go left to right or right to left? Lori, do you want to have the third to last word, and then I'll thank you all for joining us.
I so appreciate that comment. It's something that I stay up at night thinking about myself, being in a health authority context. And I think for us in health authority kind of land, thinking about, do we have the team that we're starting to curate that can help navigate some of those questions with privacy, legal, having clinicians, informatics, IMITS, information management and technology. So it's starting to think about how are we building those teams? It's the policies, it's looking for national and provincial guidance to say that, these are some of the structures, or even on procurement, how do we ask for procurement of these technologies and evaluate those, having those frameworks. Like you say, we're building the plane as we go. I sometimes think of it as we're driving the Model T down the road and we're figuring out what the seat belts are and the flashing lights are. So I think we're just in this early phase of creating who those teams are, what those documents are, what those evaluation frameworks are. So I don't have an exact answer, but I am encouraged by this provincial and national conversation. Yeah.
Yeah. I would totally agree with that. I think one of the big things we're seeing right now is in that procurement space. What are the questions you need to ask? What do some of the contracts need to include? So that's very much a live question. The other live question, evaluation is a very broad term. So when I think about evaluation in my world right now and where we're seeing the most action, it's who is competent to assess the technical robustness of these systems, who understands the data. So you need to have a certain level of expertise, and that expertise is not terribly democratized. It is sort of in pockets here and there. So who is going to have that level of expertise to really assess some of these more complicated, sophisticated systems, not the everyday sort of AI that we're seeing in the commercial space as much.
Yeah, I don't have too much more to add except that the pace of innovation is so fast. I think, to your point, Carol, around evaluation, it's hard to be evaluating, right, these technologies with a broader consensus if, I'm not even, I'm trying to be an expert in this field and I can't keep up with the innovation just in healthcare. every day there's another group that's pushing the boundaries of innovation. So how I think it's going to take a while still before there's an evaluation framework that's going to apply right across the board. So I don't know, interesting question, because it's something that I think we're all thinking about, but no one has a kind of a textbook solution for.
Caller a day?
Call it a day. Yeah. Great work.
Thank you very much.